Today, we're going to talk about a medication that really changed the game for a super common and, let's be honest, frustrating condition. We're diving into Mirabegron and its role in treating overactive bladder.
For decades, treating overactive bladder, or OAB, it always came with a catch, a big trade-off. You basically had to put up with some pretty annoying side effects just to get some relief. For a lot of people, the cure felt almost as bad as the problem itself. But then, something new came along and completely flipped the script.
Okay, so to really get why this new approach was such a big deal, we've got to understand the problem we're trying to solve first, right? Let's break down what's actually going on inside the body with OAB. So, at its heart, OAB is all about a muscle going haywire. It's not that you're making too much urine. It's that the main muscle in your bladder, called the detrusor, is contracting when it's not supposed to. Imagine it like a muscle twitch or a spasm, but in your bladder wall. And that's what creates that constant, disruptive feeling that you have to go now. And that rogue muscle contraction, it causes a very specific set of problems. First, you've got urgency. That's that sudden, out of nowhere, I need a bathroom right now feeling. That, of course, leads to frequency. You're just going to the bathroom all the time. Then there's nocturia. That's when it messes with your sleep, waking you up over and over again. And for some, there's urgency incontinence, where that sudden urge leads to an actual leak. You can see how this combination can just completely take over your life.
So, for the longest time, the strategy was simple. Just try to stop those contractions. Block them. But Mirabegron, it came at the problem from a totally different angle. Instead of just putting up a roadblock for the go signal, it actually worked on promoting a state of calm. Yeah, the old school meds, the anticholinergics, they were purely defensive. They basically worked by blocking the chemical signals that tell the bladder muscle to squeeze. But here's the problem. Those chemical signals aren't just in the bladder. They're all over your body. So when you block them, you get all this collateral damage. And that's where all those nasty side effects came from. Mirabegron, on the other hand, was a complete paradigm shift. It's in a class called β₃-Agonists. It doesn't just play defense. It goes on offense. It sends a brand new signal, a positive one, directly to the bladder muscle. And that signal says, hey, relax, chill out, expand a bit. So how does it actually do that? Well, it's a pretty cool three-step process. First, it hones in on these very specific little proteins on the bladder wall. They're called β₃ receptors. When it binds to them, it's like flipping a switch. That switch then kicks off a chain reaction that tells that big detrusor muscle to just relax. And the result? When that muscle is relaxed, the bladder can physically hold more urine. And just like that, you get more capacity, which means less urgency and fewer trips to the bathroom. And look, this new mechanism isn't just some neat science fact. It has a real-world impact. It translates directly into a way better experience for patients, mainly because it neatly sidesteps all those problems that came with the older drugs. This is really the key. Just look at this side by side. With the old anticholinergics, things like super dry mouth and constipation, they were practically guaranteed. And what's even more concerning, they could get into the brain and cause cognitive problems, like confusion or memory issues, especially in older folks. But Mirabegron, because it's so targeted on the bladder, has way, way fewer of these issues. That makes it so much easier for people to actually stick with it long term. Oh, and the benefits keep coming. It was a huge deal for patients with a certain type of glaucoma who were told they couldn't take the old meds. And on top of that, it's just plain convenient. It's a simple, once-a-day pill. It's extended release. You can take it with or without food. All of that makes it so much easier to build into your daily routine. Okay, but let's be balanced here. No drug is perfect, right? Every medication has potential risks. So to really get the full story, we have to talk about the possible side effects and who needs to be careful with Mirabegron. The big one to watch for with Mirabegron is blood pressure. It can cause a slight increase, but it can be significant, so regular monitoring is super important. Besides that, other things you might see are headaches, some common cold-like symptoms, maybe a slightly faster heart rate or a bit of dizziness. Here's a cool little science fact that explains why it's so convenient. Its elimination half-life is about 50 hours. What does that mean? It means it takes your body more than 2 full days to get rid of just half of the dose. And that super long-lasting effect is exactly what allows it to be a simple once-a-day pill.
So how does it eventually leave your system? Well, after the liver does its job, it's pretty much a 50-50 split. About 55% comes out in the urine, and the other 45% or so leaves in the feces. We also have to talk about drug interactions, which are a big deal. Since Mirabegron is processed by the liver, it can mess with how other drugs work. For instance, it can bump up the levels of certain heart meds like digoxin or blood thinners like warfarin. And that is exactly why it is so important to tell your doctor about literally everything you're taking, every prescription, every over-the-counter pill, every supplement.
So that begs the question, right? Who needs to be particularly cautious? Well, for starters, it's usually not a good idea for anyone with severe high blood pressure that isn't under control. If you have serious kidney or liver problems, the dose will likely need to be adjusted. And if you have a history of not being able to empty your bladder properly, that's urinary retention, you need to be careful because relaxing the bladder too much could, make that problem worse.
All right, let's step back and look at the big picture. When you put it all together, why was Mirabegron such a landmark drug? Why was it such a turning point? Here's the bottom line. Mirabegron created a brand new path. It was a highly effective, super targeted tool that finally gave doctors and patients a real, powerful alternative. Think about all the people who just gave up on treatment because they couldn't handle the side effects of the older drugs. For them, this wasn't just another option. It was a total game changer for their quality of life. And really, this final thought sums it up perfectly. It's a crucial therapeutic option. See, it wasn't just one more pill on the shelf. It was a whole new way of working that filled a massive gap in treatment. And it really drives home a key idea in medicine. Sometimes the biggest breakthrough isn't about more power. It's about being more tolerable. It kind of makes you wonder, what other conditions out there could be completely transformed, not by a stronger drug, but just by a smarter one?